Yeah.
Okay. Well, thank you for joining me today. It's really nice to meet you, Patrick, and I was really excited to come across your webinar the other day and excited to see the work that you're doing with families and addiction, because I think, as you know, we're woefully shorthanded in this department.
Right.
So if you don't mind, would you like to introduce yourself and tell us what you're up to?
Sure. And thank you so much, Linda. I really appreciate the opportunity to speak with you. And as you were implying, there are not a lot of us out there who understand the importance of supporting families, supporting couples when there's addiction in the family. And so it's always a pleasure to meet someone who is of like mind and gets it and understands the importance of that. So it's my pleasure to be with you today. In terms of my background, okay. I'm working on becoming a concise speaker. So I'm eager for your feedback on how I do.
Okay.
So it all started a long time ago. The family I was raised in, it was a very loving family. It was also, it could be a high stress family at times. And so it was, there was a lot of love, and then there was also a lot of chaos at times. When I turned into an adolescent, all of a sudden I developed a depression and anxiety disorders that were not recognized because I couldn't talk to anybody about it. I certainly couldn't bring it up in my family. Got through high school somehow, went off to college somehow. In college, just before senior year, basically I was not able to function due to my level of depression and anxiety. And so I took a year off. I got into treatment, and it was the best decision I had ever made. Got into a recovery after about a year, went back to school, got my undergrad degree. And I remember, and I was so excited by experiencing and living sickness and then recovery from that, that I got really interested in pursuing mental health, a career in mental health. Got a job working on an inpatient psychiatric unit, which was ahead of its time in the sense that it was a community hospital. It was a psychiatric unit, but they also did a lot of work with addiction. So it was the perfect dual diagnosis treatment program. Back then, we didn't call them dual diagnosis. So both populations, mental health and addiction, were in the same unit, same groups. We provided the same therapy, and it was highly individualized. And I saw the power of that, of helping people, and also the value of families being involved in treatment. So, and I was so fascinated and intrigued by my own recovery, thinking that I would never recover, that I decided to pursue the career. I really enjoyed the work. And I also was committing myself to working with families, because I was thinking, gosh, if my family had had these kinds of resources when I was growing up, we really could have used them. So families and getting services and support to families really became my life's mission. It was my meaning and purpose in life. Went to social work school, got a master's degree in that, worked in an intensive outpatient program for addiction. And that was a great experience. Started working in the employee assistance program field as a social worker, developed my own private practice, which I did for many years. And then I guess about, I don't know, maybe 5 years ago, maybe 8 years ago, it just seemed like all of a sudden, well, I got onto Twitter. And so I have Twitter.
For better or for worse?
Oh, so much better. Yeah, sometimes it can be worse, but that's where I started learning about like scientific research, medical research, and about medication that can be so helpful in recovery from alcohol use disorder, from opioid use disorder. Uh, and I started learning about multiple pathways to recovery. And that AA, NA 12-step, although it has helped millions of people, it's apparently doesn't help a lot of people. And we don't really even know how many people it has not helped because we don't track that. And so I started learning about all these scientific approaches to recovery. And that just opened my eyes tremendously. I had always been supportive of family involvement in treatment, whether it be for depression, anxiety, or addiction, or dual diagnosis. But then it also, I became keenly aware that there is really almost nothing available for families that is useful. Sorry. And whereas throughout most of my career, I always saw the value of 12-step. I would use Al-Anon, I'd refer to Al-Anon, I'd refer to Alcoholics Anonymous, Narcotics Anonymous, Sex and Love Addicts Anonymous, and they were always my go-tos. Then I started learning about families who were not finding Al-Anon helpful. And so I got real interested in that. And I decided to change from, in my private practice, I changed from a psychotherapy, traditional psychotherapy in person in the office, to a coaching practice because it had so much more flexibility for families. So about 5 years ago, that's when I started doing coaching work with families. And the amazing thing about coaching work with families is that you can have a family meeting with families in different parts of the country, family members.
Right.
So a father in Chicago, a mother in Atlanta, identified patient, adult child with addiction in Massachusetts. So you can bring these families together in a way that you never could have before. And
because of the licensing requirements, right?
Exactly. And with coaching, you basically, I inform all of my clients about the risks and the benefits. They don't get the same type of privacy. Our communications are not HIPAA protected. So there's risk in that. I've never found a family yet who had seen that as a hindrance or just elected not to do that because of possible privacy concerns, because this is the only help that they could access. So started doing the coaching practice and was just getting really positive results. And the families were finding it really helpful. And so I was learning more and more what was needed, what was important, what was helpful. What I was finding was that most people, most families know very little about addiction, and they know even less about dual diagnosis. And lost my train of thought. So the education gap, most of what people knew was outdated. It was old school, 12-step, rigid, inflexible. Don't be an enabler. You've got codependency. You've got to disengage. You've got to detach with love. And the families I was meeting, they didn't want to do that. Because they knew, especially with the drug overdose issue that developed over the past 10 years or so, that just brought the risk up so much higher. And they knew, or they believed, that if they kicked their loved one out of their house, there was a good chance that they wouldn't survive for very long. And then we went into the pandemic with COVID, which added another element of, it really isn't safe to be out there without a place to live.
Right. Right. So speaking of which, when you encounter these families, what are some of the common myths that you run up against about what they might believe about addiction or even mental illness when dealing with a loved one who's suffering from one of these disorders?
Great question. Maybe number one is that if you have a dual diagnosis, if you have a mental illness along with an addiction, that you cannot treat both, or that you shouldn't treat both at the same time.
Mm-hmm.
And that's still out there.
Yeah,
Most of the addiction, yeah, the healthcare system in America is so broken in every way, in every area of medicine, but nowhere quite as much as the addiction treatment field.
Well, maybe pause right there and let people know, because I don't think some people understand that like, for example, when I recently went in for treatment for my alcohol use disorder, I understood that I had underlying depression and issues that I needed to work out mentally, but they refused to refer me to a mental health provider until I achieved a certain amount of sobriety. So I couldn't even get any sort of psychotherapy if I had wanted to until I had gotten well from my quote unquote addiction first. So that's still true in 2022. And I think a lot of people don't realize that.
It's terrible. It's more than terrible. It should be criminal. It's medical malpractice.
Yes.
But unfortunately, our society doesn't look at it that way. But in any other field of medicine, if somebody had serious heart disease and also had diabetes,
Mm-hmm.
I can't imagine being treated for, say, I was having a heart attack with my coronary artery disease, being admitted to a hospital, being stabilized for the heart attack, but then having the doc say, no, we can't treat the diabetes. We got to leave that alone. We got to focus on the heart disease. We have to stop the heart attack. I mean, just the idea of that is obviously so ludicrous, right?
Mm-hmm.
So why do we do it with addiction and with depression and mental health?
Right.
And there was never any validity to that belief that you have to have a year's sobriety, a year's abstinence before you can evaluate a person for depression, anxiety, and start to treat it.
Mm-hmm.
In fact, there's one person who keeps popping up into my mind whenever I think about that notion about the 1 year. And back when I worked on that inpatient psych unit in the 80s, I remember there was one poor guy. He was probably 30 years old, had a severe alcohol use disorder. He also had a severe anxiety disorder. And he kept having to come back to our inpatient unit for resuming his alcohol use. And I remember him talking out in front of the nurse's station. I was there and I was observing a nurse talking to him, and he was saying, I get too anxious. I can't stop drinking when I get this anxious. And I remember the staff saying, we can't treat you for the anxiety, don't you understand? And that poor guy, he must have been like a revolving door for admissions because of resuming alcohol use that quickly got out of hand. He must have been admitted for 6-8 times in a period of 6 months. Yeah. And so I'll never forget that. And because I remember observing this, I was a person fairly new to the field. These nurses had a lot more experience than I did. And I just remember being struck by that because what he was saying made perfect sense to me. Mm-hmm. And I remember thinking, well, what the hell is this? I mean, why do you need 1 year's abstinence before you can? Can't you see that that's why this person cannot get the abstinence? Is because he's getting no relief from his anxiety. And in my mind, he had total credibility. The other staff didn't see that because of the way that they were trained, and they had been working in the field for many years, and I'm thinking, wow, I remember thinking, is this the best we can do?
Mhm.
And now we've got more research that shows that we can do better, and we need to do better. We need to treat the co-occurring illness at the same time as the addiction in order to give the person the best opportunity for recovery.
So question for you. So I know the statistics are very high for people who have a co-occurring mental illness, whether it's depression, anxiety, bipolar, or some other disorder.
Yeah.
But I'm wondering if you've seen addiction in people who do not have any underlying mental health, because for me, it's hard for me to conjure up an example of somebody who has a alcohol use or substance use disorder who does not suffer from some sort of underlying depression or anxiety. So I'm wondering if somehow that number seems artificially low, in my opinion, of what you're seeing, maybe anecdotally in your practice.
I would totally agree with you. I've seen figures, I just saw it the other day, or estimates of, say, around, okay, 50% for all people with serious level of addiction.
Mhm.
But for women, it can be up to 80%. So that, and that was a new statistic for me to see that for women, what was the second group? I think it might have been adolescents. For women and adolescents, women or adolescents who develop the severe addiction, some studies have shown that up to 80% of them have mental illness along with that. So 50% overall, 80% for women and for adolescents.
Wow.
And that made sense to me. I've seen figures or estimates of around 40%, 50%, but I'd never seen women broken out like that.
Mhm.
And it totally makes sense. If we look at the incidence of trauma among women,
Right.
you know, early childhood trauma, whatever, it's staggering. So yeah, so that figure of 80% made sense to me.
Mhm.
I've always been skeptical of that, you know, 40%, 50%. I don't know, it seems to me that if you don't have depression or anxiety before the addiction develops,
Mhm.
I mean, how long is it going to take before you start incurring the consequences of decisions that we've made? And we start, you know, it starts hitting the fan. How could you not develop a depression or an
Sure.
anxiety disorder?
So
You
either
know?
it becomes before or after the substance use is what you're saying?
Yeah,
Makes sense.
yeah.
Okay, so one other thing I wanted to touch upon that you brought up in the webinar that I listened to that I thought was very interesting and also aligns with what I had been thinking in my head was you mentioned that codependency is an outdated line of thinking. And I was wondering if you could speak to maybe what the concept is for people who don't understand it and why you believe that we need to move on from our understanding of what that might be and drop the term if you think it's necessary.
Great question. I don't know where this term codependency came from, but I do remember back in the day, there was a book written called Codependent No More.
I still recommend that book.
Really?
Yeah, it's still popular in sobriety circles, even non-AA sobriety circles. Melody Beattie, I believe, wrote the book.
Yeah, that's right. Yeah, and Claudia Black.
Mhm.
I don't know if you're familiar with Claudia Black's work, but she was there was this whole movement, Adult Children of Alcoholics, ACOA.
Oh, yes.
Yeah,
Yes.
okay. You don't hear much about it now. I'm sure it's still out there.
It is.
Yeah, this whole concept of codependency, it is still out there. But the idea was that, and it came from 12-step. Now, and looking at 12-step a little more closely, that was developed 85 years ago by who is it developed by? Two senior, mature, okay, old, white men very affluent, very highly educated. They were very Protestant Christian. And back in 1935, so when they developed it, so the 12 steps and the 12 traditions, they very much reflect that bias, that their experiences as privileged older white males living in 1935. So that gives you a sense, well, maybe some of the components of that weren't exactly relevant in this day and age, because we've learned more about how that can skew a person's view. So this idea was that regardless of how the addiction developed, the parents, well, it was usually in adolescence, not adults. And the parents were usually responsible for it. They had done something wrong, so that it was the parents' fault. The parents should be blamed. In that when there's active addiction going on in the family, as the rest of the family is impacted by that, and they try to respond to it, they will pretty much automatically bail that person out, try to protect that person from the consequences of their decisions and their actions, so that they invariably would develop this disease called codependency. When you had dependency of the person with the addiction, you had this codependency. The family were addicted and dependent on the person with the addiction. And there was never any scientific basis for that. There's never been any proof for that. There's never been any research supporting that. And so someone made it up. And the unfortunate thing is that what happens is that families get blamed for addiction. And while I suppose that there could, I mean, no doubt there are some families around there where there is such dysfunction and outright abuse, neglect, that sure, that's trauma, that's ACEs, adverse childhood experiences. Sure, that's going to lead to, for some people, to have a vulnerability to develop addiction. However, the families that I've worked with, I've never seen that. I've never seen families that are that damaged or that broken that are seeking help. So the first thing I do when I start working with a family is I emphasize in the very first session, and now since I became certified in the CRAFT method, I've learned to bring it up in the first session, even if I'm not hearing it, because it's always there in someone's mind. And I tell them, you did not cause this addiction. No matter what you think you did, no matter what you think about your parenting, no matter what other people tell you, you've just got to believe in yourself and remind yourself, I did not cause this. And because what happened was that we started blaming families. We also, if you think about the treatment industry, if you go into a residential program, chances are you get your mobile phone taken away from you. You have no contact with the outside world, oftentimes for a week. They try to get you for 1 month or even 2 or 3 months in residential. So for the first week, it's pretty standard. You can't have contact with the outside world. They take your cell phone away. So you're taken away from the family. And the family is not allowed to participate in your treatment. And so basically what you've got is that a person and when a person needs a residential level of care, they've been pretty impacted by their addiction illness. They usually are not real aware about what's been going on. They oftentimes have blackouts, grayouts. They may not be able to tell you how much they've been using of what. They don't necessarily remember. They're not thinking quite straight, right? So if you think about it, so then if you don't talk to the family or concerned loved ones, chosen families, all you can do is rely on what this individual is able to remember and how they see things. And they've been in a fog. And so that's how you're going to develop an individualized assessment and a treatment plan from that. It doesn't happen. So the families are kept out of treatment even if the patient wants the family to be involved with treatment, the staff generally will not allow it. And then they hide behind HIPAA. They talk about patient confidentiality. When getting the collateral information from the family's perspective can oftentimes be very useful. It's usually going to be accurate. And especially if somebody is an adult and is in a marriage, it's
Right.
really critical to bring to, with the patient's permission, of course, to reach out to that partner and to have their information, their perspective, part of the data that's looked at, and that they're also assessed for any needs that they have. And
Absolutely.
especially around discharge planning.
Yeah, 100%. I mean, you just kind of bumped into really the whole reason I started my blog in the first place was this frustration about, I was, constantly relapsing. I would get, extended periods of sobriety, but relapse. And, I was doing the best that I could to stay sober for myself. But I realized that my partner was also isolated, that he needed support. And he was also facing the same sort of stigma and shame that I was, but in a different way, right? Like he also felt embarrassed to share with his friends and family. So he was also kind of suffering alone in this whole thing. And it wasn't appropriate for him to lean on me because I wasn't exactly the stable one, So it's like, I recognized that he needed support. I recognized that I wasn't the appropriate person, but yet I couldn't, for the life of me, find somebody who offered that sort of care. And now, of course, like when we did get into treatment, I think we were so far down the rabbit hole that it was like far too late for us. But it was such a shame that I wish, it's like my big regret. Like, I don't wish that on anybody. I just wish there were people who could support families and couples who are going through this. And that's why I just think what you're doing is so amazing. And I'm excited for you to explain to everybody what the CRAFT method is and how you use it in your treatments.
Sure. And it's Linda, right?
Yes.
Linda, that article that you had pushed out to me, that is just heartbreaking. Yeah. And I mean, it brought tears to my eyes as I was reading this, because I knew where you were going with it. Unfortunately, I knew how it was going to end.
Yeah, I'm going to tear up just thinking about it.
I know. That's how I get. And what's worse, what makes it even worse is that it didn't have to be that way. It was avoidable. It might have been avoided if we paid attention to the needs of families and spouses, right?
Yeah, well, I think I remember early in our relationship, because people who suffer from substance abuse, we're not on the receiving end of like too much love and support. That's not what happens. What happens to us is we're abandoned, right? We're abandoned for our illness, and we're faced to suffer it alone, the consequences of our use and trying to pull ourselves out of it, Right. And I remember at one point when I was in a pretty dark place, just crying and saying to him, I wonder how different this would look if somebody loved me through it. And I just remember just distinctly saying that out loud, like what a difference it would make if people loved me instead of left me. Right. And that's kind of what you're doing with the CRAFT method, right?
Yeah, it's exactly what I'm doing. And the CRAFT method is part of that. And I also do, I go beyond the CRAFT method. Mm-hmm. I've always been good at what I do. Mm-hmm. And I think to a large degree, I mean, I've got this kind of sensitivity, and mm-hmm. and having struggled in my early years, and then gotten into a recovery, I think it gives me a certain amount of empathy. and the ability to relate to other people who are suffering.
Mhm.
And that's always guided all the work that I've done in the field and how I've lived my life. So I've got the craft method, and then I also have, I don't know, just something else, this temperament. And so to answer your question, gosh, there are a lot of ways that I could answer it. What people are capable of accomplishing amazing things when they feel loved. And I don't say when they're loved. What I'm saying is when they feel loved. So if you were made to feel loved, imagine what you could have accomplished, as opposed to when you didn't feel loved. That is such a huge barrier to have to overcome to gain recovery, which
Right.
which doesn't have to be there. So in fact, I'm publishing the next episode of my podcast today.
Oh, great.
And yeah, it's really good. It's the
Well, tell
best.
us about it. You can't just tell us you have a podcast and it's really good. Tell us the
Right,
name of your podcast and
right.
what is this episode we can listen to.
Absolutely. Family Addiction Coaching Podcast.
Okay.
I've had it out there for 2+ years. So today I'm going to publish episode 16.
Okay.
Sometimes there's a bit of a gap between my episodes, but the last one, which I released a couple weeks ago, and then this one, I'm changing the format so they've become more focused. They're shorter, and they're more, well, I think of them as being pro tips. The first one was how to recognize addiction. A friend of mine who's in recovery, who helps me a lot with her perspectives, we were talking about, well, what are the questions that we get asked all the time? Well, I don't really know if my loved one's use is a problem, and I don't seem to be able to talk to my loved one about it. We hear that all the time. So the first episode was how to recognize addiction, what it is, but also really importantly, what it is not. For example, babies do not get born addicted. If a mother is using substances and has become physically dependent on them, then the child will be born physically dependent on a substance. It could be alcohol, it could be an opioid. However, that doesn't mean that the baby has addiction. The baby doesn't have addiction is defined as compulsive use, inability to stop. In other words, compulsive use of a substance despite negative consequences. Babies don't have agency. They don't have the ability to make choices about using a substance or not. So one of the things we have to do is we have to clarify and educate the public and the professionals that dependency is not addiction. You don't need to have dependency to have addiction. And likewise, you don't need to have addiction to have dependency. And that there are a lot of people, say, for example, people with chronic pain, for whom only opioid pain medications can give them any relief and help them have any quality of life. And they're being affected by how difficult we've made it for people to get opioid medications. And so a lot of them are suffering. So today's episode is how to talk about addiction. So first we recognize it. Then the second piece is how do you talk about it? How do you have, maybe that first conversation, or maybe the first conversation that really goes anywhere. And so that's where I'm introducing a lot of the craft concepts.
Okay.
And so we talk about how turning your back on someone with addiction doesn't work. It just shames them. Blaming them doesn't work. But maintaining a loving relationship with that person with the active addiction, that gives them the best chance of recovery. And I use that line, when people feel loved, they are capable of accomplishing amazing things. And we see that all the time with people who get into a good recovery. And I talk about the I give 7 tips for having effective communications. One of them being like positivity, trying to send basically a positive message, but also to ask for what I want rather than what I don't want to see anymore. In other words, instead of saying you've got to stop drinking for our lives to get any better, the statement needs to be more like, I must admit, I really enjoy the times when you're not drinking. So you're asking for what you want. It's got to be precise. It's got to be concise. It's got to be brief and to the point. Nobody's going to listen to more than, say, 3 or 4 sentences about a difficult conversation. We have to demonstrate understanding of the other person's perspective. So that means we need to learn about addiction. We need to learn why it might be that a person is finding it so difficult to control their substance use. We need to put ourselves in their shoes. And we need to demonstrate that to them. We need to share a statement that shows empathy or understanding. For example, I can appreciate you've been trying really hard at your recovery and it's been a struggle for you. And I've been learning about addiction, and I know that that's not uncommon. And sometimes, despite a lot of effort on a person's part, sometimes recovery can take some time. And sometimes there are periods of resumption of use along the way. And so I'm learning more about that. And I see your efforts. And I just want you to know that I appreciate that and I love you for it. And I'm grasping that it's not a matter of just not using.
Right.
And then, well, one of the 7 tips, offer to help. And it's really important to make it an open-ended offer. Basically, tell me how I can help. Usually when we offer help to a person with addiction, our idea of help is, I want to bring you to the treatment center today. Let's go.
I've had that offer for help a couple times.
I'll bet you did. And it might have felt okay sometimes, but other times it probably didn't.
Well, I think what people don't understand is that people don't believe me when I tell them what treatment actually is. When I go to treatment, they think I get therapy. And I go, I don't get therapy. I might get a group therapy. That might be the therapy I get. But what I really get is an all-day AA meeting. And people don't really understand what AA is. And I'm like, oh, it's where I confess my sins to a room full of strangers. And I pray to God that he will remove my defects of character and remove the disease of alcoholism from me. And then I pray and keep coming back. And they're like, that sounds insane. I'm like, because it is insane. It is absolutely, completely bonkers.
Right.
And this is what we are doing to people. And so, you know, it's really hard for me as somebody who goes through these experiences to explain this to somebody because it just sounds completely nuts. So the frame of reference a loved one has is just so alien to this frame of reference that I have. So it's just kind of like apples and oranges trying to like speak the same language of what I understand to be true and what they understand to be true. Like, this is what you do. You go to rehab, you come home sober. You go to AA, you keep going to AA, you have a disease for the rest of your life, you know? So all of these things, you know, come into play when you're trying to have these conversations, like you say, and it's important for the loved ones to understand addiction and some of these topics.
Yeah, and what do people? So if you're struggling, if you have a resumption of use, and is it okay if I introduce some new language to you?
Yeah, absolutely.
Okay. I hate the term relapse.
Okay.
I hate it. It's bad. But I mean, I understand it. But my concern about when we use the term relapse, and AA is big on this, how many days sober are you?
Yeah, I don't count days.
Right, right. But they do, don't they? And they've got tokens. And so you're chipped. So there's so much of a focus on that, so if you have a slip or a resumption of use or a relapse, all of a sudden in the program, you're back to day one. It's like you've done nothing. You could have 5 years of recovery. You have a slip and you're back to square one. And they predict that you're going to be off and running, drinking at the same rate as you were when you stopped in your worst days, right?
Right.
And that's so disempowering for people when we know that people gain health and recovery, sometimes even when they're actively using. Sometimes, in other words, they show better judgment, sometimes over time. They may not stop using, but they may use less, or they may use in a safer kind of situation. For example, if they're injecting opioids, they may not use alone, and they may have a buddy system with Narcan, just in case there's fentanyl and they die, they can be resuscitated. And that's recovery. I don't care what anybody else calls it, but when we take steps to, when we show better judgment to keep ourselves safer than we used to, that's progress. And I hate this idea of like you're a second or a third or fourth class citizen if you only have a day's sobriety or a week's or a month's or a year's. And there's this like pecking order.
Yes, for sure.
People, yeah, I mean, 35 years, how did you do that? I mean, people with 35 years recovery are gods. And so whatever they're doing, that must be the way to do it. And the person who has a month, what do they know? Right?
Yeah, and very much the attitude is like, shut up and listen too. Like,
yeah,
don't even contribute because, who are you to
have
any agency or autonomy, because look what your best thinking where it got you, right?
Exactly. So take the cotton out of your
ears and put it into your mouth.
Thank you. I can't believe that I blocked on that.
I had to think about it for a second. Yeah, there's so many terrible slogans.
Yeah, long COVID stuff. In fact, you might find my first episode really useful. It's where I interview a woman who's amazing. She's terrific. She's a social worker. She's a professional. And she describes her husband's battle with severe opioid use disorder. And she describes how the treatment industry treated her husband in residential and also her. And it's unbelievable, but I totally believe her. They, at one point, in an effort to manipulate the patient, her husband, into staying, he said that he needed to leave because he was worried his wife was going to divorce him. At one point, then they lied. The staff lied, and they said, your wife says if you come home, she's going to divorce you. You have to stay there.
Gosh.
And, well, the patient left anyhow, thank God. And he got home and he said to his wife, what, you're going to divorce me? And she said, what? I'm not going to divorce you. And he says, that's what the staff said. And so they had lied about that. And one other time, she and he went through something like 12, 15 residential admissions in a short period of time. He was really struggling. And at one point, she was begging them at the facility to let her talk to her husband, and they wouldn't let her talk to him. And she could hear him on the other side of the door, crying and begging to be able to speak to his wife. It's really cruel.
That's very cruel.
Yeah, there's two great guys, Sean Fogler and Bill Kinkle.
Okay.
And they both interview me for one of my early episodes. So Bill Kinkle, and he's out, with his recovery and his severe opioid use disorder. He's the husband that I'm referring to, who I interviewed his wife in the first episode. And he and his friend, Sean Fogler, they both interviewed me for their Health Professionals in Recovery podcast. Sean's story is, Sean is a physician and he was an anesthesiologist, and he got dependent on, I believe it was opioids, and had developed a severe disorder. It got reported to the Board of Registration of Medicine. He was mandated to go to a residential program for something like 4 months. And before discharge, the staff of this program were telling him that his wife was the cause of his problem, his addiction. And if that he went back home to live with his wife, he could not remain in recovery. And he was doomed to relapse and then death, institutions, etc.
Wow.
And what was fascinating was that the staff never spoke to his wife in the whole 4 months. They never talked to his wife. But he was so mind controlled by the treatment team and by the fear of God put into him by the licensing board, that
I can see that.
he started believing what they were saying. So when he was discharged, he had a really hard time trusting his wife. And it wasn't for a little while that he finally felt comfortable enough to tell her why. And she was horrified because no one had talked to her, and she had no intention of not supporting him. And she didn't understand how she was the cause of his addiction. And
yeah, it's, I belong to this group called Life After 12-Step. And it's basically a support group for people who have left 12-step programs, who are trying to move on with their recovery, either like grow beyond the 12 steps or kind of recover from the damage that was done in the rooms. And it's really sad how many people show up really doubting that they can stay sober without AA, really putting, like you said, the fear of God into them, that like, if I don't go to these meetings, I'm going to relapse and die, or all these things. And, that's why I think for myself, I've really found a lot of solace in the harm reduction community. Like you said, that says reduction in use and better decisions is actually part of recovery, where it's like, if you make a mistake, you can kind of say, oh, okay, well, I did this better. I didn't use to this extent. I didn't make these poor decisions. And you can reflect better on yourself instead of, oh my God, I did this. I'm at day one. I'm a failure. And these cycles that just get you in the depths of despair, where you just want to keep using because you're so engulfed in shame.
Right. You desperately need relief. And so you turn the thing that at one point gave you a sense of relief.
Right. Okay, so let me ask you some questions then.
Yeah.
Okay, so I know that we talked, or did we talk a little bit? I'm sorry, now I'm mingling my words.
It's okay. Take a deep breath. Cleansing breath.
A cleansing breath. Now, I'm not sure if you brought this up on our chat or if it was brought up on the webinar. But in either case, you did say that there was a 70% success rate using the CRAFT method of bringing a person with a substance use disorder into treatment. Is that correct?
Yeah.
Okay, and that's in opposition to the tough love or the Johnson method of the traditional intervention that we see on like the television shows, right? Which has a 30% success rate, right?
Yeah.
And then Al-Anon, which is the most dismal at 20%.
Right. And I also want to be fair to Al-Anon. Al-Anon was not designed to bring a loved one into treatment. It was only designed, it was only designed to improve the quality of life of that individual who is impacted. So,
Right.
they're not striving for that. So I just throw that caveat out as
Okay.
well. But it is relevant in the sense that the way that the addiction treatment industry is based on the 12 steps, that's what people are going to get. They're going to tell the family to go to Al-Anon. People at Al-Anon are going to give them some advice. And a lot of therapists, most therapists, if they do work with addiction and if they do work with the families, they're going to be approaching it from an Al-Anon kind of perspective, which may help some people, but it doesn't help most people. It doesn't help my families.
So that's what I wanted to clarify on this point. So when we're talking about it brings the person into treatment, are we talking, what type of treatments are we talking about? Are we talking about traditional AA? Are we talking about residential rehab? Are we talking about psychotherapy, motivational interviewing? We're bucketing all of this under one bucket of treatment?
Yeah, it's the latter.
Okay.
We're not specific about what type of treatment it is, but it's the basically for someone to be able to say, yeah, I'm in treatment now. So it could be outpatient, it could be intensive outpatient, it could be not intensive outpatient, it could be going into residential, it could be building a recovery support network, but it would be with professional treatment. If somebody was just going to a mutual support organization, that would not count.
That wouldn't count. Okay.
Right.
Okay, that's an important clarifying point for me. Thank you.
Sure. If I could expand on that a little bit.
Absolutely.
It's also useful where CRAFT is real good at improving family relations, teaching family skills like better communication skills, how to set boundaries, how to hold back. Well, I hate the term enabling, but we haven't come up with a better term than enabling. But how to help the family understand and decide what kind of support is useful versus where is the line where a certain kind of support might actually inadvertently be contributing to the problem.
Right.
So, for example, if you give a loved one, all the money that they want, and if you have no expectations for them trying to gain health and recovery and just let them do whatever they want, that would not be a good situation. It might make it almost impossible for the person to recover. So the concept of allowing people with addiction to bear the consequences of their decisions it's very important. And I'm sorry, I forgot I was going to expand on something. Lost my train of thought.
No worries. We have been talking quite a bit about CRAFT, and I don't think we have defined it yet or explained the acronym, have we?
Community reinforcement and family training.
Perfect.
Yep.
And the thing that kind of stuck out to me when I was re-listening to the webinar a second time when you talked about this, it really sounds to me that like most of CRAFT is all about like really good communication. It's like, how do we communicate about difficult subjects in a way that is supportive and loving? So it seems like a really useful skill, whether you're talking about depression or anxiety, substance use, but really any difficult subject could use these tips, don't you think?
Oh, absolutely. And it's big on communication, as you said. The communication skills that we learn from CRAFT are generalizable. So, for example, I've used those communication skills when I've got a difficult conversation that I'm having with my partner. And once I started using those communication skills to talk about this other issue with my partner, it's just like it was like a breath of fresh air. It's like we weren't at loggerheads. We weren't having this conflict that it was a really tough conflict. And we weren't like that. We felt like we were on the same side. And
Right.
both of us felt like we felt understood by the other, and we felt like we understood the other.
Yeah.
And so it just allowed us to resolve that kind of logjam, that impasse that we were at, so that, and then we started feeling the love. Not that we didn't love each other, but like we just experienced more love for each other because it wasn't being held down by all this conflict.
Right. Well, I think you said something important there. Feeling the love, right? Because you're aware that you're loved, but feeling the love, like you said, is very important. Like in the moment where, you know, I said to my boyfriend or my ex-boyfriend now, what it would be like if someone loved me through this. It was, I knew he loved me. It was clear he loved me by how upset he got with me and like how much he was invested in me getting better. But I wanted to feel loved despite my substance use problem, and loved while I worked through it, not isolated while I tried to work my way through it.
Absolutely. Yeah. Yeah. There was a family that I worked with. I worked with the parents primarily. And they were absolutely amazing. So just real brief, they have a 35-year-old son who has had a severe alcohol use disorder for 15 years, in and out of treatment, a lot of residential programs. He'd been to so many, the parents wouldn't tell me how many because it was just too upsetting to them. So they, after trying to help him in a lot of different ways, they found CRAFT and they found me. And so I started training them in the CRAFT method. So I took the CRAFT training from Dr. Robert Myers, who developed it. He created it back in the 90s.
Yes, this is the book, right?
Yes, community reinforcement approach. Yep. Yep.
There it is.
Yeah. And so he took community reinforcement approach, which he had developed, and he developed it even further into community reinforcement and family training. So so basically I was working with the parents and training them in these different CRAFT methods. And so instead of and then assigning homework in between the sessions and then reviewing the homework, because we learned through practicing, the family started describing how they changed, the parents had changed the way that they approached their son, and that if their son was still in bed because he had been up drinking all night, instead of making snide remarks or trying to wake him up to get him to go to work, they would, when he had woken up, they would come and sit on his bed with him and they would say, "Looks like you're having a rough day. Do you want to talk?" And I said, "What?" I heard them describe this. I said, "That's what you did?" And they said, "Yeah." And how did you feel about it? We felt so much better about it. And my son felt better about it. And I said, "That's amazing. That's an amazing shift, you know?" So after 3 sessions of training them in the CRAFT method and them practicing it, all of a sudden, for the first time in 15 years, they reported the son asked them for help. And that's when I learned.
I can definitely see that change.
Yeah. And I said, "What, 15 years? He's never asked you for help?" Because I'm thinking, well, how did he get into these facilities? And they said, "He's never asked us. We always saw that he needed the help. We got it for him, but he never asked us for it." So what a shift that was. And then he reached a point where they just started, they understood more because they had to be educated. And I had to explain to them, and he's got a dual diagnosis with depression. So once they understood that better and they are applying these other methods, it just, there was more love in the family. And the last time I talked with them, the son had, he had built up 90 days of abstinence from alcohol. And he had never gotten more than maybe 2 weeks in 15 years of trying. So he was at a 90-day mark. He was still suffering from depression, had trouble getting out of bed sometimes. But there were moments like, for example, at Thanksgiving, he was able to engage with the extended family and have fun with them. And he was able to enjoy it. And the family was able to enjoy him. The extended family was able to enjoy him. And it was a miracle.
Yeah. Yeah. I'm sorry, you might hear my dog snoring over here. Yeah, I mean, that makes a lot of sense because, you know, I'm just seeing this through my own perspective of how it would change my attitude towards sharing with a loved one if they were to come sit with me and stay with me in kind of such a vulnerable state, right? Feeling hungover, feeling ashamed, knowing you messed up, feeling full of regret, and someone saying like, hey, this is probably a really hard day for you. Like, how are you doing? Instead of immediately like feeling like you have to hide in that shame and like disappear, because that's all I always wanted
Drown
to do.
in it.
Yeah, just run and hide.
Yeah, it's such a profound shift. And as I worked with these parents, and I talked to the son a few times, trying to help him find quality treatment. But I remember talking to the parents and saying, you know, it sounds like you kind of love your son more now than you did. And then I corrected myself. I said, not that you didn't always love him, but you're more in touch with your love for him. You're feeling the love. And they said, yeah, that you're right. They didn't know how to put into words, but they said, that's absolutely correct. We're so proud of him now for all of his efforts. And now we understand how difficult it is to gain health and recovery, especially with a dual diagnosis. So they agreed. It's like they found their love for him again. They had more access to that love. And it was just a beautiful, touching, that was a nice discussion that we had. It was like, I'm thinking to myself, wow, I've never seen this happen before in all of my work.
I'm gonna nudge my dog so maybe he stops snoring so loud.
I can't hear him.
Oh, okay, great. So maybe it's not being picked up on the audio. I can hear him. Yeah, because I think, you know, at least in my experience, that the emotion that, you know, people who love me could identify most with would be anger, and then secondary would be disappointment. So, you know, and it's hard to combat those emotions, right? Especially when you're coming from a place of shame.
Right.
Yeah, so I mean, I think this is like all really, really beautiful, what you're doing, and I just commend you for it, and being one of the few people that I've come across who are really working in this area. And I just feel really grateful that I crossed paths with you.
Thanks. Me too. Me with you. And I just feel for you so much. And I mean, you represent millions of people out there. You know, yours is not an unusual, isolated story. And I mean, what's interesting is that when I interview people for the podcast, my guests, they always end up learning something about themselves, because I like to go in deep dives with people, and I reflect back and I say, is this what you mean? Is that what was happening? And they always feel good. They always are really glad that they guested, and they always feel like they have learned something. And because I'm always hearing, you know, I never really thought of it that way. So I mean, that's part of the education too. People, even people in a good solid recovery, nobody goes back. Nobody goes back. Well, there's that concept of making amends for harm done, right? But that kind of sounds like penance. But what I find is that even people in really positive, healthy recoveries, significant amounts of time, they don't really go back to family or loved ones to have a discussion about what things were like back during their period of using. And I don't know, I mean, maybe for a lot of people that's for the best, but I can't help but wonder if for some families or couples, I wonder if that it's like if you don't go back there and address it somehow to have more understanding and more empathy for each other both ways, it seems kind of like that could be something that could maybe drag you down if it's not dealt with.
I think so. I think I shared with you that I'm in school for marriage and family therapy. So,
good for you.
Yes. Yeah, thank you. I'm really excited about it. But in one of our recent classes, we had a therapist who works with underprivileged youth, and he uses hip hop music in his work. Yeah. And he played a song for us that was by NF, if I remember correctly. And it was basically about his mom who overdosed on opioids. And it was a really impactful song. I teared up afterwards talking about it. But what happened, what I didn't realize is because I'm pretty open about my experiences with my class. So they all know, that I struggle with alcohol use disorder. What I didn't know about them is how prevalent it was in my classmates' families, whether parents or siblings or whatnot. So when they reflected back on the video from their perspective, they teared up because they loved somebody who struggled and how hard it was to be the child, for example, of a parent who was using, or the sister of somebody who had relapsed recently. And that fight between loving them and also being enraged at them at the same time, like grateful they're alive, but pissed off that they're still using, sort of thing.
And terrified, probably.
Right. And so it was, it really struck me, because I think one thing that I would say that I didn't do well in my relationship was have empathy for my partner. And I think that's because all of my resources were used to try and stay sober. And I don't think sometimes we get enough credit for how difficult that battle is. But I think because of that, this is the only time I actually will kind of take the word selfish and say that, okay, like there is some credibility to that to a certain extent, but not in a negative way. It's just a necessity almost, that to engage in sobriety and to overcome the emotional hurdles you have to get there, it just takes all of your effort, mentally, physically, and otherwise. And so it's hard for me to look at my partner and see his fear and his hurt and all of these things, and then still do the work that I have to do. And so it's easy to kind of shut that out and not reflect on it. But then to see it is also very important, I think. Yeah, absolutely.
And if you don't know, nobody knows that, like you didn't know it when you were, or you couldn't fully appreciate it because you, as you said, you had to focus on recovery, and you couldn't get involved in, worrying about your partner. You had to really focus on yourself. And maybe there was nobody there who could have told you that's okay, or actually that's a good thing. And also tell your partner she's not going to be able to attend to you in a way now that she probably will be able to do in 3 months or 6 months or a year. and just like hang in there.
That's weird,
And this is,
yeah.
yeah, I mean, who would know that? The treatment programs aren't going to tell you that, right?
Yeah, I did find a couple good resources on that. You know who writes a good book about this is Matt Salis. I don't know if you've come across him. He
No.
wrote Sober Evolution with his wife, Cheryl, if I have that right. And he basically writes about his own alcoholism. He calls it alcoholism and calls himself an alcoholic. So I'll use those terms, not
Yeah.
because I do, but he does.
Yeah. Yeah.
But he talks about how he got well and how he recovered his relationship. And he now runs a podcast with his wife, and they talk about all of these issues and things like that. And they also have recovery groups for people who suffer with alcohol use disorder and also for people who love them. But it's a really great book. And he touches on that thing exactly where it's like, hey, like I couldn't help my wife. Like I was so involved in getting myself better. Like I couldn't be with her, but I also needed her to get better too. So it was like we were separate and we both had work to do before we could kind of come together. And how insulting it is kind of to tell the partner you have work to do because you've been damaged by my addiction and we need you to get well as well, but I can't be there for you right now. You know, that's
Right.
kind of a big blow.
Right.
So so his book I recommend. He has some neat things too, if you ever want to check him out.
Sounds great.
Yeah.
Sounds great. Your writing is so powerful. It's so incredible. And I think that piece is the only thing that I've read by you. And one of my friends, Amanda, she's the one I referred to. She helps me do this work, and I met her on Twitter, and she's in recovery herself, 15 years, dual diagnosis. She read, I said, you got to read this woman's article. It's just like, wow. I mean, not only is the content really good, but there's something about how she crafts the story, the narrative, that is just really engaging. And she agreed with me. She wrote back and she said she is a really good writer. and she's got writing skills herself. She knows talent, but it's really, there's something about your style of writing. It just holds the reader, and in a nice way, though, you know.
Oh, I appreciate that.
Yeah, you've got incredible talent.
Oh, thank you. You know, I had a lot of loss last year. But my grandmother was a writer. She was a poet. And after she passed away, we were cleaning out her bedroom and we found all of her poetry books like tucked away under her bed. And I remember thinking, I never want to be this sort of writer where like my writing is just tucked away under my bed. Like if I have something to say, I'm just going to go ahead and say it. So it was actually like her death and the demise of my relationship that kind of propelled me into writing this blog. So I thank my grandmother for it.
Yeah, that's incredible. And it sounds like it's been healing for you.
It's been, I would say it's been an intense labor of love. It really is. Like I tell people that my blog is a love and resentment story because that's what it is. I mean, it's definitely comes out of like the love I had for my ex-partner and still have, right? But there's pain there and there's resentment that like we didn't get the help that we needed. And I hate that, right? And I'm definitely one of these people that it's like, okay, so how do we like not have that happen again? You know? And it's like, unfortunately, like I'm not going to get that second chance, but maybe we can give that second chance to somebody else who needs it. And so hopefully we can send out these resources, you know, people who are doing lovely things like you're doing, to support families and couples who really need the help. And it sounds like you're doing a just fantastic job. And I just really have enjoyed meeting you and learning about you. So I just
too,
really
Linda.
appreciate you being here today.
Thank you, Linda. I feel the same way. I'm so glad that we ran into each other. And there's not many people who get it, and you get it.
Yeah.
And that's it. It's encouraging.
Yeah, I think you can just spot like a like-minded, like kindred spirit when you see one. And I think that's why I'm always so eager to pounce. It's like, I think I just know right away. Like,
Right.
Another one.
Right. Well, I'm glad that you pounced, and it's so, yeah, I'm really impressed with what you're doing and with your grasp. And I mean, if I could ask, if you feel comfortable, do you want to share how long your recovery has been?
So I have been working on my recovery for like 6 years, but I don't have like an extended amount of sober time. So my longest period of sobriety has been about 5 months. But I am, for lack of a better word, like a chronic relapser. So this is where the harm reduction piece has really come in handy for me, because I've had a better way to understand what happens when I do drink and recover from it in a way that has less shame attached to it. And that's why I found a lot of comfort in people who use drugs to be so supportive in a way that the alcohol community has actually been really isolating. I also found this great work. Do you know Dr. Lance Dodds?
Yeah.
So I got to interview him last week, and I read all of his books over Christmas break. But you know, his book, The Heart of Addiction, also really helped me get, I think, for the first time, really towards what was at the heart of my addiction, which you really don't do in a lot of these peer group supports. And because, like I said, I didn't really have access to a therapist. I do now. I just pay for my own therapist since I can't get one through my insurance provider. So I think I'm building the resources that I need for long-term recovery. But at the same token, I think I'm at a point where it's less important to me to have consecutive days sobriety, as it is important to me to be generally whole and well. And that those two things don't necessarily have to coincide for me to feel good about myself. And they used to be very dependent on each other. Like,
oh yeah.
So it's kind of this like new terrain that I'm in, that I'm kind of playing around with. So I'll tell you one more idea that I've been bouncing off with a friend of mine also that I met on Twitter, who's very smart. Some of the smartest people are on Twitter, aren't they?
I know, right?
Yeah, I know. But we were talking about actually opioid users and how chronic pain patients are really having this hard time getting their opioids. Right. And how there's actually this kind of like hierarchy in like drug users, where if you're a chronic pain patient, then you can use opioids. But if you use opioids just to like relieve psychic pain, for example, then somehow it's not as even playing field. Like you're kind of like more of an addict than somebody who just uses it to release pain. So we got into this idea that, can you use drugs to relieve psychic pain? Is that a legitimate purpose to use drugs for? And we think, yes, it is, right? So if you think of trauma as something that cannot necessarily be healed, but can be managed, right? So it's not like a broken bone, right? You can maybe like set it, but it's not ever really going to heal. Then maybe it's not crazy that people are self-medicating. Maybe it's crazy that we're telling people with a certain amount of trauma that they need to be sober to suffer through it. that might actually be kind of an insane thing for us to request of them. So this is just kind of something we've been bouncing around in our heads. Excuse me. Sorry, my dog. Walnut, shush. So
I totally agree with you.
yeah, so we've been thinking about that and wondering if maybe sobriety is not the answer for everybody.
I agree. I totally agree with you. It's another, I mean, that whole word sober, it's like, it drives me nuts. I mean, I get it, but it just reminds me of this: abstinence is the only recovery, right? And so, and what does sober even mean? Ian, like, what the hell does that even mean? I don't know.
And it doesn't even mean the same thing as recovery, right? Because then you have the whole term, which I really hate, of dry drunk, which don't get me on a tangent on that term.
Oh yeah. I
But
forgot
like,
about that one.
yeah, that somehow if you're sober, that's not enough because you need to be working a program and like on this perpetual self-improvement ladder, or else you're not really in recovery, because that's bananas.
Right.
And I was just like, that's nonsense. Like, your sobriety is enough. But also, if you found a way to kind of, there's this quote my friend said to me. He said, if you found a way to leave AA, not maintain total abstinence, and not shame yourself, do not underestimate how hard that was.
Right.
And I thought that was really powerful because I hadn't really thought about it that way. But it takes a lot of deprogramming to kind of struggle with substance use in a way that people look down upon, and not look down upon yourself for it.
Oh,
so,
right.
So
one of the things I love about craft is that it's all about positivity. And part of the effective communication is you have to find something positive to say. You have to praise the person. You have to give them credit. You have to say, you've done a really good job with this and you've worked really hard at it. And I just love that. And what I find is that the families and people like you, individuals with addiction, they oftentimes need help to understand that you can have recovery even though you may not be like 100% where you want to be, or and you may find yourself resuming use for a certain period of time for whatever reason. But to focus on the gains that you make, and like I said, if someone can inject drugs with a buddy with Narcan to save their life in case they pass out, that's great. That's recovery, because you're staying alive and you're mitigating risk and you're using in a safer way. And that's just as valid as somebody who has reached a point of not using at all, in my mind. But you have to find it. You have to find the positive aspect, the thing to feel really good about. And it's not our natural way of approaching it.
No, and it's not. I think, and that's why I'll return to people who use drugs as another example of people who have really kind of reclaimed, quote unquote, recovery, even though I think they hate that term too, as saying, I might use drugs, but if I'm reducing the harm caused by that, then kind of that's an okay place to be. Kind of like back off sort of thing. Where we don't do that. Like it's really taboo to talk about moderation or return to use in any capacity if you suffer from an alcohol use disorder, even though I did find some research to support that up to 50% of people who meet the criteria for alcohol use disorder do and can return to moderate use. We don't talk about that, right? Because that's taboo. And the people who are returning to use, they're not talking about it. They're not saying, I used to go to AA and now I enjoy my drinks. They don't talk about that, right?
Right.
So these are some of the things I come across that go bouncing through my head like a ping pong ball.
Yeah, and half the people who get into a recovery do it on their own without any treatment, without any help. They just do it. And
Yeah.
we don't necessarily know why, but
Yeah.
half people in recovery did it themselves somehow.
Mhm. Yeah.
Have you read Carl Hart?
Uh-oh. You haven't read my latest blog, I take it.
No, I must not. You write about Carl Hart?
I did. Carl Hart is a very generous man, and I felt very badly for not agreeing with what he's had to say. So I loved his book. I thought it was a great book. I loved the history of learning about drug use and everything. But my main problem with the book and why I reached out to him was I had a problem with the term grown-ups, which he identifies and defines in the book repeatedly as responsible, employed, eats healthy, takes care of their duties, yada, yada, yada.
Yeah.
These people can use drugs. If
Yeah.
you don't fit into that category, then you can't use drugs, which to me just said that like it's another way of separating users and non-users as well. In a lot of ways, I thought what he was doing was classist. And also in the same way, while he's talking about the racism of, the war on drugs, the people that he talks about who are targeted for the war on drugs are exactly the people who are, in his definition, are not going to be people he identifies as people who can use drugs because they're more likely to be un or underemployed, more likely to be suffering from oppression, and therefore more likely to be depressed or suffering with a mental illness. So all of these things, unable to eat nutritious food, probably not working out, maybe not taking care of their parental duties because maybe they're working 3 jobs or whatever. I don't know. But so do you see where I'm kind of going with this? It's like, on one hand, he wants to uplift this community. And then on the other hand, it seems like he's saying, this community also can't use drugs. And then there was another trouble I had with it is that he says, you can use drugs for pleasure. He's fine with pleasure, but he kind of totally sidesteps using drugs to reduce pain, which is a very valid way to achieve happiness, which he gets at. And then my final point on this whole thing was, if he's going to say that based on the Declaration of Independence, that life, liberty, and the pursuit of happiness is an inalienable right, then we have that right regardless if we're responsible or not, right? It's inalienable, meaning I have it whether I have an addiction or I don't have an addiction. So you can't tell me if I can use or not use. So you can't actually use both those arguments at the same time. They're counterproductive. So those were my critiques of his work. With that said, I do feel for him as somebody who's going to come out as one of the first professionals and academics to admit to his drug use, that it's a very touchy and taboo thing to do, and that his book may have been safeguarding against some boundary setting around that. Like, I'm not just opening the floodgates for everyone to use drugs. Like, you know what I mean? There might have been some of that going on that I think could have played into it. So I felt badly for it because I really thought he was an exceedingly kind and generous man. He spent time with me that he didn't need to. And I didn't enjoy criticizing his work, but I also couldn't get around it because of the term he used so frequently throughout his book that I just thought was unfair. What were your thoughts?
So you interviewed him?
I did.
So you had a chance to have a discussion, debate.
I didn't really have a discussion debate with him because it was not my intent.
Oh, okay.
My intent, because I emailed him first, and I basically said, I enjoyed your work. I'm in the recovery community. When I see these terms like grown up, it makes me feel like these are responsible users and these people can't, and blah, blah, blah. So he wrote me back and he kind of answered it, but not in a way that I really thought covered it. So when I interviewed him, we did talk about it. And at the time, I accepted the answer that he gave to me. But when I reflected back on the interview and I re-listened to it, it didn't add up. What he told me and what the book said were two different things. And so I had to go by what the book said, because that's what people are going to go off of. They're not going to go off what Dr. Harp told some girl on the internet in a phone chat. They're reading his book. And what I really, really struggled with this, to be honest. So what I did is I sent him a message and I just said, I'm going to critique your work. Not like really super excited about it, to be honest, but if you would like to respond to it, I will post it in the same thread. So you can rebut it if you would like. I'm a nobody on the internet, but it was the only way that I thought that I could have any sort of integrity about the whole thing.
Yeah.
He did not respond to me. But I gave him the opportunity to write back to it if he wanted to.
That's good.
But those were my thoughts on the whole thing.
Yeah. I think that's a really positive way to do it. And I mean, kind of like agreeing to disagree.
Yeah, I mean, like I said, I think that's an important work. I think it's definitely like a step forward, and maybe I should update my work to make that more clear, my piece on it. I think it moves us in the right direction, but I think what I'm worried about is that it just kind of still scapegoats people who suffer with substance abuse issues, and says only certain people can use these drugs and certain people can't. And these are the reasons you can, and these are the reasons you can't, and you can use it for pleasure, but not for these other reasons. And so that was it. And I talked to about 5 other people about my concerns before I put them out there, and they all kind of had the same concerns. So I felt kind of validated before I put it forward. So
yeah.
He's
I love Carl Hart. And I also find him to be a kind, gentle person and a good soul. And he also, he doesn't deal with addiction.
intentionally.
Right. And so for me, it's kind of like the jury's still out. Like, can you do the kind of writing and advocacy that he does, and not consider people for whom drug use can be dangerous? And
No.
so that's the part that I struggle with. On the other hand, I think he points out he's got so many good positive points about the
100%.
racist classic drug war and how it's killing people, and especially people of color, minoritized groups. And he's such a strong voice, and it is refreshing. I find it refreshing to have someone say, yes, I use heroin and I like it, and it enhances my life. And I think we should all have the ability to use it like most people have the ability to drink, and it can enhance people's lives, kind of thing. So I appreciate that.
Well, he does make a point in his book that I was trying to make when I got in trouble when I was at rehab, because they tell us we have to be sober from all mind-altering substances. And I'm like, that doesn't really make any sense to me, because everything I do all day long has the intent to change my mood, to alter my mind, right? Like, I have a cup of coffee, I want to wake up. I take a shower because I want to look presentable or whatever. I hug my dogs because I want to feel loved, you know? So I'm constantly going through a state of trying to find comfort and solace and food and changing my mood, right? Going for a run if I'm angry or whatever. Not that I do that anymore, but I used to. So to tell me that, like, I can engage in these behaviors to change my mood, these are acceptable ways to change how you feel. But if you use these drugs, that's unacceptable. So it's like sex, acceptable to change the way you feel, but ecstasy, unacceptable. Like, that kind of doesn't really make any sense, especially when you consider that we're putting people on antipsychotics and antidepressants and anti-anxiety meds, you know, and my doctor doesn't have conversations with me. Like, for example, they gave me Lexapro. Nobody told me anything about dependence, anything about what would happen to my brain. So when I decided I didn't need Lexapro anymore, and I tried to get off Lexapro, I suffered the most debilitating withdrawals I have ever experienced in my entire life. And I actually had to go back on Lexapro in very small doses over a period of time because I couldn't sleep. I was getting these brain zaps. I couldn't sleep at night. I would fall asleep during the day. It was a complete mess. I felt like I had the flu. And I was like, hey, gee, would have been nice to know this before I put this drug into my body.
Yeah, right.
But, you know, we put these serious drugs into people's body without really giving them the full information. And then we tell them that they can't put in these other drugs that they might actually enjoy the side effects from, you know what I mean? Like,
right. Yeah. That's, yeah. I mean, the kind of the withdrawals that people can go through if they stop the antidepressants abruptly, it's real. It's real. And it also points out how dependence is not the same thing as addiction. You were not addicted. You were dependent on the Lexapro because it changes your neurochemistry in very profound ways, so that if you don't have it in your system, you feel like shit, right?
yeah.
So, yeah. I used to work with Lance Dodes.
Oh, you did? I'm sorry. It's Dodes.
Dodes, yeah.
Okay.
Way back, 1985, 86, as part of my social work degree, I did an internship at McLean Hospital in Massachusetts, and I was on the addictions unit, and he was one of the psychiatrists. He's one of 3 psychiatrists on that unit, staff psychiatrists. So I had met him. So that's when I first ran across him, and I knew he was a psychoanalyst as well as a specialist in addictions. And I knew that he had written this very controversial book about AA and and then I mean, I was never like close friends with him or anything, but yeah, he's got some really interesting ideas.
He is really smart. I'm struggling to write his article because he says so many smart things. All I want to do is just quote him, which I might just end up doing.
Yeah.
Just write like a Q&A sort of thing. The only thing that I question about his work that I'm kind of like not really like sold entirely on is 2 things. So he talks about addiction as a compulsion, right? So addictions to substances is no different than addictions to behaviors, which I'm not quite sure I believe that. In fact, I don't think that I do. And he thinks compulsions change quite easily, that if you're addicted to, say, alcohol, that you may just as easily become addicted to gambling or to sex. And I haven't really found that to be true. Now, of course, this is not based on any sort of research. This is just based on what I've seen in recovery communities. I found for myself and for people like me, we're very specific about the drug that we like. And we don't really change. Like I'm very specific about the alcohol that I like, and that doesn't even change. I don't even switch from red wine to tequila, for example. Like if you put beer in my fridge, I probably won't drink it, even though it's alcohol in there.
Yeah.
But so that part questioned for me. And then the other part, and again, I was speaking to my friend on Twitter about this as well, was that, okay, so you get to the heart of your addiction, right? So the sense of powerlessness, the sense of helplessness, that is like your main cause, right? And for me, I've identified that as like losing love. That's my like big core wound. I use those words, he doesn't. But that's my thing that like really freaks me out, which is why this past year has been so troublesome for me, losing my grandmother and my boyfriend at the same time. Like, it just broke my heart. But knowing that, he says you can identify your triggers more easily and make decisions about using and make different decisions. I don't know that knowing that is going to cause me to make different decisions necessarily. I think it's an important piece of information, but I don't know that that information alone is enough to make me want to change, unless I have that desire to change already, for example. So, so I'm just not sure that like, he gets me maybe like 85% of the way to where I want to be, but there's like 15% that's like missing. Like, I don't feel like the circle's complete yet.
I guess I have a similar kind of reaction to him and to his writing. I mean, I found it refreshing, and it's nice to have another pathway that is not dependent on the 12 steps. And I think that was mostly what I appreciated his work for, because when he first started coming out with that, it was a time where nobody was saying that. And this idea of multiple pathways, nobody was even, it wasn't even a thing. You know, I mean, it was in real life, but nobody talked about it. Nobody dared talk about it. But he did. He talked about this other pathway. And without knowing a lot about what he was proposing, I just thought it was just refreshing to have that other voice come out saying that this is another way to go about it.
Yeah. Well, and I think, in all fairness to Carl Hart and Dr. Dotis, is that I don't think I'm going to get 100% satisfaction from anybody who writes about this topic. You know, I don't think anyone's going to get me 100% to where I want to go with this. You know, I don't think we're there yet. And I don't know that we ever really will be, right? Like, because really, like, we're trying to solve ultimately like the cure for depression, anxiety, and trauma, right? And are there really cures for those things, or are there just kind of panaceas and things that make you feel better temporarily or help you manage the symptoms of that? And I think that's kind of maybe more what I was going after when I was talking about managing your use as more of like symptom management, where I'm not saying that I'm going to remove alcohol entirely from my life, but saying alcohol use is sometimes something that I use to manage the symptoms of this source of helplessness that I feel. But I try to use it very rarely, for example, like might be a better descriptor of where I find myself in the recovery continuum right at the moment, you know?
Right.
Yeah.
Yeah, I mean, I think Well, the thing I love about craft is that it's just so damn positive, and
Mhm.
it helps people see benefits, and like what you're describing, in your recovery journey, it sounds like you might not be where you want to be, and you don't want this to be the end point, but you're seeing value, and you're finding some relief sometimes, and you see yourself as advancing, and you've got,
Yeah.
and you're, so I guess you're still finding your way, but aren't we all? I mean,
Yeah.
I am.
Yeah. I mean, well, and that's the thing too. It's like, if I had put my life on pause for sobriety, I would still be on pause. At some point,
Right.
I just had to say, fuck it all. Like, this might be as good as it gets. So I've got to live with this thing, better or worse, and go back to school and go for the job and, go after the guy, even though he breaks my heart or whatever.
Yeah.
Because otherwise I'm going to be in this cycle of, what if I never get there? And I'm always just waiting for sobriety that never materializes. Or maybe
Right.
I get sobriety and it's not what I wanted anyways. Who knows?
Right.
I don't really know.
Right.
But
We
I'm
don't have to
still,
be defined by our illnesses. We are much more than our health conditions.
yeah,
Even when it's addiction, even when it's depression. That's
yeah,
that's not all of us, thank God.
yeah. Well, this has been an absolute treasure. So
Right.
great to talk to you,
Yeah, I've
and
enjoyed it.
had so many different topics and books to talk about, which I love.
Yeah, yeah,
You just
I
happened to hit
appreciate
the
it,
nail
Linda.
on all the recent books that I've just been reading in the past like month and a half.
I know, I'm impressed.
You
And do you know Maya Salovitz?
know what? I have both of her books that are just kind of sitting on in my queue. I've heard amazing things about her. I follow her on Twitter, and I'm looking forward to her work.
Yeah, yeah. And I'm not much of a reader. I mean, my reading is Twitter.
Which is great reading, by the way.
Yeah, you can find it. And I she's on my short list, so I get everything that she pushes out, because I'm not on Twitter. I'm on it a lot, but not a huge lot. And the stuff that I just learned so much from her. She has great points, and she has great ways of like using analogies, and metaphors. I don't know. I find her just really cool and useful, and I just think the world of her.
Yeah. Yeah. Well, I have a huge addiction library. So I'm very like much backlogged, which is funny because when you brought up craft, I was like, I've never heard of it before. And then when I was reviewing before I met with you today, I was like, wait a minute, I have that book. I know exactly where it is, because every time I learn something new, I buy the book, even though I may or may not read it.
Right.
So I got that one. And then I also got this one that you recommended.
Yeah.
So
That,
I've got the companion series.
yeah. That's, I recommend anybody to get that,
Okay.
any families, whether you're working with a professional or not. That's what we use when we do the craft training of people. And I also like that I'm not just craft. And sometimes a family says, oh, I know about craft. We just wanted to be freestyle and unstructured. And then we do that. And then maybe I say, what about if we focus on this craft piece relative to what we've been talking about? And they say, yeah, okay, we'll do that. And then we do that. And at the end of the hour, they say, wow, this is really useful. I'm glad that we did this. So I'm picking and choosing to meet the needs of the families, and just being totally respectful of where they're at and what is going to be useful to them, rather than me imposing my ideas onto them and trying to get them to convert.
Yeah. And I mean, and that's the thing we're all after, right? Meeting the patient where they're at, the family where they're at, not trying to enforce where they should be.
Right. And feeling loved, loving and expressing love, and it's so loving. I've been saying I love you even to like coworkers. But I've been making very deliberate statements like that to people. They probably think I'm going off the deep end, but that's fine too.
It's totally fine to go off the deep end.
Yeah.
All the best people are off the deep end a little bit.
Exactly.
Well, I have loved this conversation.
Yeah, me too. Let me know what you write so I can be on the lookout for it.
I will absolutely. I will send it to you so you can take a look at it before I push it out. I have no idea where it's going to go at this point, because now we have almost 2 hours of content to filter through.
Right.
So who knows what I will conjure up with, but it will be fabulous because you are fabulous and this was wonderful.
Thanks.
And I also will send you this recording, and if you so wish, I can send you the transcription as well if you would like.
Oh, that would be great. I mean, I think it was just a fun, really interesting, fascinating conversation. And
agreed.
Yeah, and with some editing, I think I think there's a lot of useful information that we covered, and I love that you're speaking from recovery. Sure. And sharing about what you experience and what you're learning from others in the recovery community. I think that really makes it super fascinating.
Well, I will send you the video and the transcription, and you will have those by the end of the day.
Thank you so much. I appreciate it.
You're so welcome. Okay, enjoy the rest of your day.
Thank you. You as well, Linda. Bye-bye.
Bye.